Good morning. Today I'm going to talk about the ankylosing spondylitis. So, what is the ankylosing spondylitis and how the patient succumb with ankylosing spondylitis? As we know that it is inflammatory conditions of the spine, but it can also affect the peripheral joint also, extra axial joint as well. So, what will the feature? The when you suspect that this person is having ankylosing spondylitis, so you have to ask when it started. Mostly, it start in the young patient, and what is the main features that will be there. So the patients come to you with the back pain. The patient complain of the back pain, and if it is young, you can think about it. Also, the patients may complain that he is having difficulty in mobilizing, particularly when the young person complaining that in the morning time when he wake up, he feels that he is having the stiffness of his joint, particularly the back joint, and some back pain. So these are giving a hint towards that this gentleman is having ankylosing spondylitis. Sometime also the patient complain of the shortness of breath also. So that is the also some other features that patients may have. Then what is the things that you have to ask? So when you are talking with the patient, so what is the history? What are the important points? So can you pause and can you tell me that in the history what will you will ask, and then I will tell you. So let us talk about the history. What are the important points you must ask? So first you have to find out that these problems, like he is having the back pain or movement problem, is it because of what? Is it weakness? So that in the ankylosing spondylitis, there is not any kind of the weakness mostly. And what is the main point which that is the pain and the stiffness. If the patient is having the pain and stiffness, it is going with the ankylosing spondylitis. You have to ask some other problem to know when it's get more, such as he is taking the rest or long hour work. If the where he is working in the garage and it is cold, and lot of bending or manual work, so it is affecting him. So, and also the age, as we already talked, that it is mostly affect the young people. Since how many months or years he is having this problem. Then you have to concentrate on the family history. Sometimes the family history of the ankylosing spondylitis and other thing can be associated, such as inflammatory back pain or psoriasis, eye problems such as iritis. So these things also can be in the family, and also inflammatory bowel disease. There is one important clue that you will get, that if the patient is having early morning stiffness and get relieved by activity, that is very much suggestive that this gentleman is having uh, ankylosing spondylitis. And also ask the patient that he is having some other problem, such as psoriasis, bloody diarrhea, or inflammatory bowel disease, acute eye inflammation. So these are the associated features also you have to ask, such as chest pain, shortness of breath. So this may there can be also uh, problem with aortic valve, maybe AR, aortic regurgitations can be there. Also the fibrosis, that is mostly apical fibrosis, so shortness of breath can be also there. Also you have to ask any pain in the foot. So it is give you, by that you can find out whether the patient is having enthesitis. Enthesitis means that there is inflammation in the tendon. Either it can be Achilles tendons in the foot, also some other tendons also it can be possible some other place also. Then also ask about the any other pain, such as there can be plantar fasciitis, the fascia of the foot can be affected, so that can give you. And also ask about the other joint or any a small joint involvement is there or not. Other things that you may ask about, any other joints such as cervical, dorsal, lumbosacral pain is there or not, peripheral joint is involved or not. Also have to ask about the any pains that is radiating to the limb or not, any numbness and other things, because the spinal cord that can be affected, the nerves roots which are coming down, that can be affected. Also to ask about whether the exercise is improving it, and any kind of the other medications such as NSAIDs that is helping or not. any burning sensation or the water work problem is there or not, that is giving you a differential diagnosis such as reactive arthritis. Also, it is associated with the reactive arthritis as well. So both either associations or differential diagnosis could be there. Also ask about loose motion, so inflammatory bowels disease associated, that is we call the enteropathic arthritis, that can be also. Okay, in this picture it is important. We have to look at what are the common features, and what are the things which are most commonly affected and less commonly. So which you have to consider in the history, also during the examination. You have to look in the eye. You have to ask about the eye. It is 40% common. So you have to. I first go with the most common things. Neck, you have to ask about the neck. It is 75%. You have to ask about the any stiffness in the neck as well, as you will examine. So look for the movement in the neck. So that is also important. So neck movement, and also to ask, that is 75%. Shoulder, you have to ask is there any shoulder pain is there or not. Then coming about the rib spine junctions, that is the expansion, chest expansion, it is 70% involved. So we have to look for the same age patients and same gender, what is the difference. So the chest expansion is also important. Other thing is the lumbosacral joint, that is can be involved, so that is important. And the 100%, that is sacroiliac. So you have to ask that there is pain, you have to press that area for, so look for that any tenderness is there or not. Other things are the less common, so not that much important, but heel is also a little common, so you have to ask about the heel, any sorry, any pain in the foot is there or not. So we have to look Achilles tendinitis, or also look for the plantar fasciitis. So these things you have to ask. So other thing is the less common. You can just go through it. So that is the list common things. Okay. Here we will tell that this is the some criteria for the diagnosis as well, and the classification of the ankylosing spondylitis. Sorry. So in the there is two division. One is the clinical criteria, another is radiological. So there is should be one and one. If both are there, that is diagnostic. But if only clinical features are there, clinical criteria is there, then it is less likely, but it can be suspected. So clinical criteria we already talk in the history also. So there will be low back pain and stiffness for more than 3 months, which improves with exercise but not relieved by rest. So this is the one criteria. Another criteria, limitation of the movement of the lumbar spine in the both sagittal and frontal plane. Third, limitation of chest expansion relative to normal value correlated for age and sex. And in the radiological finding, what you will find that the sacroiliitis, that is, it should be more than grade 2, and if for the bilateral, if it is grade 3, 1 is sufficient, but if it is 2, then it should be bilateral. So these are the criteria for the ankylosing spondylitis. Okay, here is the one gentleman who is examined by as you can see that this gentleman is having some posture is changed. You can, if you look closely, that lumbar lordosis is lost, and so he is also the neck is extended, what we call the question mark like posture, right? So here we will look for that the neck movement also. We will look for the neck movement also. Also look for any other features, such as how much is the patient able to bend forward, sidewise. That is important also. Right. Then the bending forward is also important. And then auscultate heart and lungs. Then we talk about the management plan. So mostly it is exercise, physiotherapy, and medication is the most important. We have to tell the patient to keep them active, and do the physiotherapy is also important. Medications it's involve mostly NSAIDs, the painkiller. Also we can use the other drug. We can use etanercept also.